29th of April. And again, for the wellness calls, we are positioning these every final Tuesday of a month. Sometimes it's the 4th. This month happens to be a 5th Tuesday, but we're just going to use the final Tuesday of every month. So we have calls on the 1st, which is the balance call. We have calls on the 15th, which is the midway call. And then we have the wellness call, which will be the final Tuesday of every month. So with that in mind, we are obviously just a couple of days away from the next thing that we're going to show, the next call coming up on the 1st. But again, for the 29th of April, we're glad you're with us. And it's my pleasure to bring on Dr. Cesar Fernandez. We'll invite him to start his video now. I will hide myself. Never a good sign when I'm the only one showing. There we go. Now he's officially Dr. Fernandez, live en vivo y via satélite, coming to us from Honduras. Ladies and gentlemen, please welcome Dr. Cesar Fernandez.
Hey, thank you. So I'm very pleased and very excited to talk to you again. This is your call, your monthly call for the last Tuesday of each month, as Dave just said. And I have an amazing information today because I think that the topic today is very, very important. The meta-inflammation is something that is quite basic for you to understand. So where are we in our road to our well-being during life? Okay, so meta-inflammation is a type of low-grade chronic inflammation that occurs silently in our bodies. So now I'm going to share to you some slides just to make you understand easily how meta-inflammation is something that is wide in your organism. All your systems are related to meta-inflammation. So meta-inflammation, the hidden health threats. Meta-inflammation is something that, according to recent research, is described as a process of low-grade chronic inflammation that occurs silently in our bodies. And is described as a process that results in metabolic syndrome also. I don't know if you understand what metabolic syndrome is. Metabolic syndrome is a compound of issues in your systems. For example, high cholesterol and triglycerides. For example, high levels of liver enzymes. For example, high blood pressure, insulin resistance, and problems with your circulation and your metabolic area, including obesity. Okay, so many of these problems are life-threatening. It may form the basis for many chronic illness conditions developing from adrenal fatigue syndrome. I'm going to go through that topic in a few seconds. It is therefore crucial to address the root cause of meta-inflammation to be able to lead a good quality of life. So understanding this, adrenal fatigue syndrome being crucial, but also known as hypoadrenia, has signs and symptoms. It is described but not totally accepted by the science and the medicine, but it's there. It's something that it's there. And adrenal fatigue syndrome, it's been described as the inability to remember things, memory issues, unexplained hair loss, pain in the upper back with no clear reason, tendency to weight, unable to lose it. Do you identify with it? Specifically around your waist, dyspepsia, right, which is like gastritis and reflux, high frequency of getting the flu and other respiratory diseases. Oh, I got you, right? Lightheaded when rising from a horizontal position. Did it happen to you Before, palpitations spontaneously, you started to palpitate and you say, what's going on? I feel fine, but my heart started like boom, 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 and then it stopped. Dry, thin skin, something else, and alternating constipation and diarrhea. Is that strange, right? And a lot of people feels also lethargy and lack of energy, hypoglycemia, low body temperature, reduced sex drive, mild depression, infections that tend to last longer than usual. That's a complex thing named adrenal fatigue syndrome. It is not used to be diagnosed by medical doctors in their clinics. Why? Because it is only described but not totally accepted. But it's there. The thing is, it is there and we can't ignore it. Okay? Adrenal fatigue is not recognized, as I just said, but it depends. It goes around the adrenal function, which is regulate stress responses. Cortisol, which is an hormone produced by your adrenal gland in the upper side of your kidney, not only helps your body to cope with stress, but this hormone also has many important roles that includes suppressing your immune system, regulating blood pressure, and controlling your blood sugar levels. So this is why it is totally related, okay? And another thing is that this drives us to understand that there's two types of inflammations: acute inflammation and chronic inflammation. The progression from acute to chronic it's been described. For example, if you have an allergic reaction, environmental irritants, infection, trauma, injuries, burns, lacerations, cuts, wounds, this is acute, right? It's a response. And it's a need, it's very, very important for your body to have this response when this happens. But they disappear as soon as the allergic or the infection or the wound, it's gone. But the thing is that there's a chronic inflammation that drove you to a cardiovascular, pancreas, intestinal, rheumatoid arthritis, cancer, neurological, or reproductive disorder. This is something else. And let me make the difference between these two. The acute inflammation and the meta-inflammation differences. For example, the activators of acute is a pathogen. For example, a wound, and it's local, and and they activate transcription factors and cytokine expression, which is the response of the inflammation, right? But in the other side, meta-inflammation is activated by the excess of nutrients, for example. It's activated by sedentarism. It's activated by obesity. It's activated by dysbiosis and a lot of aspects. But it is not located local. It is systemic. It is in your organ. It's in your muscle, your liver. Okay, it's in your visceral fat. And they both activated transcription factors, cytokine expression, and they both raise inflammation. But the acute one raise the energy expenditure, but the meta-inflammation lowers your energy expenditure. They both has to do with insulin resistance, and they both recruit immune cells. So they're very, very similar. They have different activators. They located in different aspects, but the thing is that meta-inflammation is a low degree inflammation, and acute inflammation is it's limited. Okay, it goes, it makes a spike, and then it's gone. Meta-inflammation just stays there like a spark, like sending a little bit of light and damaging tissues for months, for years, until chronic diseases are exposed. Okay, let me go on again. So there's a vicious cycle, okay? We have, for example, in the left, inflammatory drivers. You don't need to understand all of this. Just picture it, okay? Inflammatory drivers, for example, like sedentarism in your lifestyle, for example, as infections, for example, as a pure diet, or exposure to pollution, just to name some, okay? This inflammatory driver brought you to mechanisms of chronic inflammation. This mechanism of chronic inflammation that are described, just to mention some of them, like oxidation, like mitochondrial leaking, like insulin resistance, etc., drives you to aging pathology, aging-related diseases. Aging-related diseases has hallmarks of aging. These hallmarks of aging are already being described: dysbiosis, stem cells exhaustion, mitochondrial dysfunction, senescence of your cells, telomere attrition, epigenetic changes, etc. Okay, so hallmarks of aging drives you to more chronic inflammation. More chronic inflammation drives you to the mechanisms of chronic inflammation that drives you again to aging pathologies, and the vicious cycle keeps going on. For example, like I just told you, chronic inflammation has primary antagonistic integrative areas that are being impacted. Like I told you, dysbiosis, telomere attrition, epigenetic alterations, mitochondrial dysfunctions, etc. So if you get to understand this, now you're going to get to understand this also. Obesity is the old pandemic of the 21st century. Nobody talked to you about this. The thing is, let me tell you something. If obesity is accepted as a disease, all the insurance companies would need to accept, all the chronic diseases derived by obesity, derived by meta-inflammation. That's the difficulty, because it's a matter of an amazing amount of money that is going to be released if obesity is understood to be a pandemic of the 21st century. Let me support this. More than 50% of the population of the world is affected. Could this be a pandemic? It is a disproportionate relation between energy intake and energy expenditure. Okay, that's it. That's obesity. Your intake of energy in food, in calories, are much more than the energy that you expend. Okay, and another thing is this causes an excess of adipose tissue that generates continuous exposure in inflammatory mediators. Okay, this is a process. It is easy and it's all over the world, but nobody is trying to hit on it. Nobody is accepting it. For example, in 2023, in this journal, they says inflammation, name it as obesity, is a syndrome of inflammatory response. It is a disease. It is a disease. It is a multi-system inflammatory syndrome. What happens is that if we understand that obesity has to do with type 2 diabetes, hypertension, dyslipidemia, cancer risk, mood disorders, heart disease, reproductive disorders, liver disease. If you understand that it is in the center and it's detonated by problems in your nutrition, problems in your lack of exercise, problem in your supplement and in your mental health. The thing is that obesity is detonating all of this. And it has been described. How does it do it? The white adipose tissue affects directly your muscle, directly your heart, your vascular system, your brain, your gut, your pancreas, your liver, your immune cells, your brown adipose tissue. It is described physiologically. How does it works? How does it affects all of these systems, all of these organs? Now, if you would understand just a little bit what the European obesity and its impact are being described already. For example, in males, how does it impact on neurological and psychosocial areas? For example, high incidence of strokes, cognitive decline, increased prevalence of mental health disorders, etc. Respiratory association with obstructive sleep apnea, hypoventilation syndromes. Digestively, it is increasing the risk of metabolic dysfunction, liver problems. In skin, for example, the dermatologist associated with acanthosis nigricans. This is the black area in your neck. Have you seen it? And psoriasis, for example. Reproductive, linked to infertility. Endocrine and metabolic disorders, elevated risk of type 2 diabetes, metabolic syndrome, hormone disturbances, cardiovascular problems, immune, some cancers, including colon cancer, prostate, and liver cancer. At a renal level, elevated risk of chronic kidney disease. And in your muscle and skeletal area, predisposition to osteoarthritis, reduced mobility, and sarcopenia, which is the lack of muscle in your body. So this is male. What about female? It is basically the same, but in the area of cancer, they include breast risk, endometrial, and ovarian cancer. But all of the other are basically the same. So we are both men and male and female impacted by obesity in all of this area, in accordance to the European Association for the Study of Obesity. It has been described how the liver and the adipose tissue and the intestinal gut microbiota are being affected by activated immune cell cytokines, insulin resistant, causing a metabolic inflammation, a meta-inflammation affecting and causing type 2 diabetes, cardiovascular diseases, and neurocognitive dysfunction to be detonated, to be shown, to be manifesting the genetic in a genetic way. And what else can I tell you? If you understand that the process of this healthy liver to simple steatosis to MASH, which is the liver with steatohepatitis, and then at the end with a cirrhosis, and all of this derived to cardiometabolic, pulmonary, type 2, kidney, and bone metabolism problems, everything derived from genetics, basically, prenatal factors, postnatal factors, which is diet, exercising, even breastfeeding has to do with it, the management of your gut microbiota, insulin resistance, etc., genetic factors. All of this has been described. You need to understand and not to know it, not to try to explain it, but you need to understand that all of this is a process. It's a process that we could do something. For example, in obesity is basically has another side impact, as I just told you, in the microbiota, decreased diversity of microbiota, lower some population, decrease another populations, higher rates of another bad populations of bacteria, or larger populations of some of them, that increases levels of some components that are not good for your health. Understanding this, the aftermath of gut dysbiosis doesn't has to do only with obesity. You could see here is dysbiosis and obesity. It has to do with all of the chronic diseases that I've been talking to you about. All of them. So focus on it. It's been described. Here is the bibliography if you want to take a picture and go there and read it and take a look at it and show it to your people. It's very important. I have a new thing to tell you right now. Obesity due to a virus. Have you heard about that? Have you heard about how this could be a game changer? Look, let me tell you something. There's a virus described, which is called adenovirus 36. Okay, one of the causes of obesity, the review to the pathophysiology. It has been published since 2021 in a nutrition research. Some of you might be laughing right now. I knew there has to be something else. Even water raises my body fat and my weight. I remember those words from my patients. But let me support all of this. Did you know that obesity began to skyrocket all around the world around 1980 in rich and poor countries alike? Fast foods, sodas, TVs, computers, microwaves, bigger portions of food, no exercise at school, and lots of all of these things are said to have caused the obesity epidemic in America, for example. However, poor countries like Paraguay, Central America, and South America countries also with that has none of those luxuries, certainly not as many as we do. So why do they have a higher rate of obesity than America? Very poor countries have a skyrocketed obesity. And just to mention one, Mexico. Mexico have raised the pre-diabetes, diabetes, obesity over the United States, just to make an example. They are in first place right now. So how do you explain that? If in Mexico you have 60 or 70% of poor people without access to all of this that we pull a finger to as the causes of obesity. So what could the answer be? And if an infection could be the answer, just to mention an example. It is not the only thing, but it's described as a problem because they took a lot of population, yes, human beings, and they took a sample and they found out that a lot of a high 80 or more percent of people are positive in their blood of adenovirus 36, a type of a virus that causes propension to be obese. Adenovirus 36 and fat cells, they emerge as an epidemic cause in the problem of obesity in the world. Okay, so there's another thing I need to talk to. These are topics that we could stay 1 hour in each one of them and just mention them, just to make you understand the context, okay? There's a neuroendometabolic syndrome. I'm not going to talk. This is another topic we're going to go through in the future, but it has to be with this stress response. And it can be seen as complex web consisting of systems and organs linked each other, forming a functional network. The master circuit panel of this could be like the main electrical circuit of a house, which contains various groups of circuit breakers, each controlling an area of the house, but collectively they are tied to one another. How can I explain? Okay, we have functional integrative medicine. Detoxification, inflammation, narrow effect, cardionomic, hormonal, bioenergetic. I'm not going to talk about all of them. I am going to focus only on inflammation. I am focusing only on inflammation. I need to understand that this is integrative medicine. Okay, we need to understand that inflammation is a circuit. It consists of the immune system, the gastrointestinal tract, and the microbiome. The inflammation circuit is part of the NEM stress response, neuroendometabolic stress response. And to any situation, your body keeps itself healthy and working optimally, and it is natural biological response to inflammate. I just told you that. Most of the different inflammatory diseases starts in your body gut, as I just told you. From there, they spread to different parts of your body. The gut's lining is permeable, meaning it allows certain substances to pass through and enter the bloodstream. Let me show you a slide. Leaky gut syndrome. We need to have in the enterocytes or the mucosal membrane cells tight junctions. When they are not tight, they are leaky and inflamed. Okay, so they let go through toxins, gluten, microorganisms, heavy metals, etc. Go through where? To the bloodstream. When they reach the bloodstream, then your immune system responds. The IgG immune response, the IgA reaction, type B and type T cells are being released. And what happens? Nutrient malabsorption, autoimmunity and autoimmune diseases, food intolerance, blood-brain barrier breach, okay? It means inflammation in your brain, systemic inflammation. Systemic inflammation. So if you understand this chart, if you understand this slide, you understand the leaky gut syndrome and why this is the entrance, or the let me say it in another way, the main entrance of a lot of problems. That's why we said there's a gut health axis, not just a gut brain axis. It's a gut health axis. Okay, so let me end up the presentation right now. Let me see how much time do I have. Oh, where's my? Okay, we still have 2 to 3 minutes. The common symptoms of inflammation circuit is nausea, back pain, frequent urination, anxiety, fatigue, bloating, stomach pain, constipation and diarrhea, bad breath, joint pain, and headaches. Remember, I'm focusing only on inflammation right now. These are the common symptoms of beta-inflammation or inflammation circuit. Conditions related to inflammation circuit: autoimmune, multiple sclerosis, lupus, rheumatoid arthritis, inflammatory bowel disease, Crohn's disease, celiac disease, irritable bowel syndrome, candida overgrowth, small intestine bowel overgrowth, Lyme disease, food sensitivities, fibromyalgia, chronic pain, jaundice, the reflux disease, gastritis, bronchitis, asthma, urinary tract infections, mold toxicities, Marcons. I don't know if you know where Marcons is, multiple antibiotic resistance, coagulus negative, staphylococcus. It's a chronic bacterial disease that you just can't get rid of it because it's a very resistance to antibiotics. It's a type of infection. It's chronic and it's a cause of meta-inflammation also. It's stealth infections. Stealth infections are mixed symptoms of muscle and joint pain, fatigue, neurological symptoms, insomnia, and anxiety. Two of them are being mentioned: Lyme disease and a strep. Strep is a type of bacteria, Streptococcus, which is also resistance to antibiotics. Viral, fungal, bacterial chronic inflammation response syndrome. So there's a bunch of conditions related to meta-inflammation. What can you do if you're suffering for all of this? If you detect that you have most of them, increase whole foods, organic, especially vegetables and fruits. Organic, no pesticides, no herbicides, organic. Decrease as much stress as you possibly can. Mental health. Improve your gut health by having probiotic supplements or foods, and reach for an adequate supplementation. Whatever course of action you take, however, please do so with your guidance of your healthcare professional. He or she will help you understand the options you have and will recommend the proper dosage of any supplement. I am just going to mention the last minute what we have. For example, antiviral effects of curcumin on the adenovirus replication. It's been published in 2020 in the Journal of Microorganisms. And it says that human virus associated with obesity and inflammation, while curcumin is a natural compound, which is anti-inflammatory and antiviral. Some research suggests that curcumin could inhibit virus replication and entry into cells, potentially offering a strategy to treat or prevent obesity, inflammation associated with adenovirus 36. Okay, so this has been published, the effect of this, and also for the countries like the US and Canada and Europe that has vitamin D included in Nanofy and in Curcumin Plus. This is a good news for you. National Library of Medicine of the US says that adenovirus 36 also responds with the effect of vitamin D levels in obese and overweight patients. It is closely related, and it's also been said that the deficiency of vitamin D has been associated with an increased risk of obesity and metabolic disorders, and some studies suggest it might modulate the effects of adenovirus 36 infection. So we have the answer. In 2014, Molecular Nutrition and Food Research found this, and Vitofy make a bond with this lab and this patent and this discovery in 2016, and they launch our products with this nanotechnology, nanomicellar technology that has been published in the NIH in the US. We have our own research, and we have a process that understands that we took these 3 patents, the German patents, from the root, the turmeric root, to the micelle, to the nanomicellar technology, and we have a final product. And this final product is the one that we are trying to let the people understand. We have the best of the best. We have a need outside. We have another pandemic of meta-inflammation, obesity, and everything that we just talked about. And we have an option. We have a support. This is not a medication. We are not going to be treating anyone. We are going to be giving them something better than treating them. We're going to give them an option to regain the proper function of the cellular level. This is better than treating something. Why? Because your own systems, your own your own body, the properties of your cell functions, we're gonna be reactivated, regain, and you're gonna have the proper solutions by your own body's well function. Okay, so this is the end. As you could see, I get excited very easy because I am connected. I believe in this. I love this, and I love impacting all of these amazing people like you and the people that you talk with. Please share all this information. Tell them that tried it, regain their well-being, and take an opportunity again to have a quality of life. Like Arnold Schwarzenegger says once, let's get old as young as possible. Okay, so I love you guys, and back to you, Dave, if you're still there.
Thank you for that great presentation, and we look forward to seeing you on the next calls. Thanks, everybody. Have a great night.